Coronavirus has upended parts of the nation's healthcare system, straining resources in unexpected ways. But it's had a specific impact on organ transplants. And as Maya Rodriguez tells us, the virus isn't just impacting transplant surgeries, but also the organ donations themselves.
For Steve and Linda Trilling, it's a trying time, balancing fears of the coronavirus and awaiting the chance for Steve to get a kidney transplant.
Everything got pushed back.
But Steve is fortunate. He found a match in a living donor. The problem, though, the coronavirus caused most hospitals to temporarily stop transplant surgeries. Steve's wife, Linda, a nurse, understands why.
Because I want him to be healthy again. I also wanted to be in a safe atmosphere.
Right now, more than 112,000 people are awaiting an organ transplant in the U.S. While most will get an organ from a living donor, approximately 1/3 of all organs used in transplants come from donors who died in motor vehicle accidents. When widespread lockdowns kept people at home and off the road this past spring, those particular organ donations dropped, as did others. David Clausen is with the United Network for Organ Sharing.
Starting in about mid-March, organ donation really plummeted fairly abruptly.
Safety measures instituted since COVID-19 emerged include testing organ donors, and Clausen remains hopeful the transplant system will begin to return to normal.
And so right now, actually, the system is increasing the numbers of transplants, and really things are getting fairly close back toward what we saw prior to the pandemic.
But that may depend on where you live. Record numbers of coronavirus cases are emerging in states across the South and West, straining hospital resources. And just this past week, one of the largest hospital systems in Miami placed some transplant surgeries on hold. For Steve and Linda Trilling, there's hope his dialysis may become a thing of the past, with a potential transplant surgery date set for later this summer.
So we are so blessed that we are, and that we have a donor, that we have a goal, So that is, I think, my biggest thing is having him off this lifeline.
Just trying to get back to normal.
A normalcy that's been missing for them far longer than for many of us. In Washington, D.C., I'm Maya Rodriguez.